Hi, everyone. So glad that you can make it this evening. Um, we're really glad to have our community get here together to show our concerns and discuss vaccine equity with representatives from Alameda County. We have a few tech issues I just want to let you know about. Um, Please stay on mute until we open up the second half of the meeting. We're going to have some speakers for the first half, and then towards the end, the second half, we'll have some open it up for questions. But we want everyone to stay on mute so we can keep the background noise to a minimum. And we'll mute folks as needed. So we have captioning available. If you go to the bottom of your Zoom screen and choose show subtitle, you should be able to have the captions. Okay. And if you have any problems with the captions, why don't you put it in the chat and we can see if we can figure that out. And then we also have ASL interpreters. They will be spotlighted. Just let us know if you have any access needs that we aren't addressing in the chat, and we will, or press 9 on your phone to raise your hand. We're recording and live streaming to Facebook. ASL does not stream to Facebook, but we will invite people to join the Zoom if they need ASL. And we'll share critical information from the chat out loud. So why don't you go ahead and introduce yourself in the chat. It'd be great if you could put your name, your city, and the reason why you're here tonight. So go ahead and introduce yourself. We have a lot of people here.
Image of Mr. Mendacity himself, the man who made he did today totally.
And just a reminder to keep yourself on mute unless you're speaking. So we're gonna go ahead and start talking. So as you all know, COVID has really hit people with disabilities and seniors pretty significantly, and higher weight people very hard, including particularly in the Black and Latinx and Indigenous communities. We're seeing similar inequities with the vaccine, and really we're here to learn and collaborate and speak out to make sure that all of our communities have access to the vaccine so that we can save lives. So I'm Nikki, and I'm the program officer for the Disability Inclusion Fund at Borealis Philanthropy. And, one of the reasons why I'm here tonight is because I am a person with a disability, and I employ 6 attendants on a regular basis that come into my home to provide care for me. And I also have a mom who's 88 years old. I have a cousin who has breast cancer, and my brother has recently been diagnosed with like congestive heart failure. And except for my mom, who's 88 and who is able to get access to the vaccine, um, the rest of us are like under 65, and with the governor's current with the governor's currently talking about prioritizing people by age as opposed to the original tier system. I've been really, I just luckily was able to get my mom on a list to get vaccinated. So she's actually getting vaccinated tomorrow. But it was really, really challenging to make that happen. She's a Kaiser client, and I felt like I was stalking the Kaiser website to see if I could get her vaccinated. I was literally going on twice a day, every day for like the last like 3 weeks to see if she could get an appointment to get vaccinated. And um, then I signed her up on her county's website, my county's website, like every kind of. I was going to Safeway, all the like every possible place I could go to try and get her vaccinated. Um, I think this is one of the issues for seniors is that my mom doesn't have email, doesn't really know how to use a computer, and so she really had to rely on me and my sister-in-law, who's her caregiver, to try and work that out to get her vaccinated. Um, and for me, um, having attendants come into my home also, I feel like it puts me at risk. I've had a couple of attendants who've had COVID scares already. Um, and So for me, it's just really vital that I get vaccinated as soon as possible. They've all been able to get vaccinated because they're IHSS workers, but yet I'm not able to get vaccinated some because the governor doesn't see me as a priority. So this is one of the reasons why I'm here tonight, and I'm really glad that we're having this discussion. So I'm gonna let Michael Lyon welcome you from SDA. Michael, you're on mute.
Thank you. Tonight's event is sponsored by Senior and Disability Action, a community organization of seniors and people with disabilities fighting to improve housing, healthcare, and transit. We've been based in San Francisco, and we're now expanding to the East Bay, and we're very excited to be here where so much is happening. This is also sponsored by Senior Services Coalition of Alameda County, Hand in Hand, the Domestic Employers Network, Fat Legal Advocacy Rights, and Education Project in Genesis. Thank you. Nikki?
Yeah, thank you, Michael. So throughout the event, you can put comments and questions in the chat. I will try and read some of them out. And we'll have time for people to speak in the second half. So I just wanted to remind people that we will definitely have time for questions and answers after we've listened to some of our speakers. So why don't we go to our first speaker? Ira, are you there? Or should we go?
I think we're actually starting with Gwendolyn.
Okay, thanks. So we're gonna go to Gwen Butler. She is on the board of the Regional Center of the East Bay. So Gwen, why don't you go ahead and take it away? I think that you are on mute, Gwen. There we go. I have unmuted you.
Hi. Can you hear me?
Yep, we can hear you.
Gwen, we can't see you. Do you want to show your video
I
again?
can barely hear you. Well, anyway, my name is Gwen Butler. I live in Fremont. I'm a senior, and I got a couple of points I want to make about COVID. My first point is about COVID. Many people don't have the ability to wear a mask. They are at high risk because they rely on caregivers or live in a group home, and many have health problems which they cannot wear a mask. So because of COVID, we have lost services that include school, day programs, job, transportation, etc. We have the Zoom, but it's difficult because some don't have internet service, or it's not that touchy-feely thing that you have when you have that in-person thing. And you feel kind of isolated, and you don't have access to the community for it's been almost a year since we had access. Many are homebound because of COVID. We are limited to our friends, our family, and loved ones. Okay, my next point is about vaccine. I don't think this is my personal opinion, I don't think there should be an age requirement, because I know I heard of many younger people, a lot of them have, when they have disabilities, they have, what's the word? They have other medical problems where if they catch the virus, they really in danger. And so it shouldn't be an age trap. Matter of fact, they should be first. The people that's senior and the people that's disabled, because there is because they have a underlying disability. And a lot of people, they cause them to have a mental, because of the COVID, it's a mental thing. They may not be aware of it. Depression, stir crazy, all kind of different things. You're not aware of the mental problems that can happen due to your long time isolation. You've been in isolation so long, 24/7 for almost a year. And well, me, myself, they call me a road runner. I like to go. I like to be active. I don't like grass to grow under my feet. I like to be doing something. I like to go. I leave here, my home, at 7, 8 o'clock in the morning, and I'm back at 5, 6 o'clock in the evening every day. That's just me. But now I'm at home 24/7. And I feel that's not fair. It's not right. It's not, I don't know. It's just not right. And okay, that's all I got to say. That's all I got to say. Thank you for
Thank you, Gwen.
listening.
Thank you, Gwen. We really appreciate your being here with us tonight. For our next speaker, we're going to hear from Brandy Senziak. I hope I said your name right. And if you're going to talk about why the vaccine is so important for higher weight individuals.
Hi, thank you. Yes, so my name is Brandy Senziak, and I'm the supervising attorney at Independent Living Resource Center, San Francisco, and the legal director at FAT Legal Advocacy Rights and Education Project, as well as one of the co-founders of #NobodyIsDisposable Coalition. So yes, tonight I'm going to talk about the vaccine. And sort of give an update of what's going on with the vaccine. The guidelines for the California priority keep changing. We got a new priority announcement was made yesterday even. So I want to back up and tell you sort of where the vaccine has been and where it is now. So the CDC issued guidelines to states, advising states that they should prioritize people that are 65 and older and people that are high risk of serious complications from COVID. However, as we know, each state is coming up with their own vaccine allocation system. So California originally, before this federal CDC announcement was made, was issuing the vaccine on a priority tier system, which included tier 1A of healthcare workers, veterinarians, people living in long-term care facilities. And then the tier system also had tier 1B, 1B1 and also 1B2, and then finally 1C. And people with disabilities were included under category 1C originally. After the federal government issued guidance to prioritize individuals that are 65 and older and individuals with conditions and disabilities that would put them at higher risk of serious complications from COVID, the California decided to only implement half of the federal government's suggestion. So California decided that they would prioritize individuals that are 65 and older, along with healthcare workers and all of the other people we talked about in category 1A and 1B tier 1. But that after that, they were going to move to an age-based system, leaving people with disabilities and medical conditions that put them at higher risk for severe complications if they were to get COVID completely out. We were not being prioritized at all, but we would face discrimination if we were to get COVID and there was a care rationing situation happening. So the state of California says that their main goal in allocating these vaccines is equity. That's what they keep saying at multiple meetings that they have. But not giving priority to groups, not giving priority to these groups that we're talking about. So people with disabilities or people that are high risk, if they, for medical conditions, if they have COVID, or people that are higher weight individuals that are actually seen at the top of the list of having severe complications should we get COVID. Basically, California, so basically California is saying that they want equity, but California is not focusing and not giving priority to any of these groups. And not giving priority to these groups have a disproportionate impact on communities of color. This is unacceptable. So disability and higher weight advocates continue to advocate for individuals with medical conditions or disabilities that would put them at higher risk of serious complications if they got COVID. We've been advocating hard for many weeks, and actually even before the new year. But finally yesterday at the state's Vaccine Advisory Committee meeting, it was announced that after Category 1B Tier 1, California would prioritize individuals with certain disabilities and conditions that put them at higher risk for serious complications from COVID. However, the state is also currently proposing a restriction that we would only be able to receive the vaccine from healthcare providers that could verify our medical records. This is unacceptable because it is making it harder for disabled people and people with medical conditions to receive the vaccine. This requirement was not listed as one of the requirements when the state had us in Category 1C. There is no need for this requirement. Individuals can get a letter from a doctor confirming that they are eligible due to their disability or medical condition. This requirement of not being allowed to get the vaccine where everyone else can get the vaccine creates hurdles to the vaccine that are directly opposite to creating equality. It is clear that our advocacy around the vaccine priority is not over. We will continue to advocate. The Nobody is Disposable Coalition created a community survey to find out stories from people that have been delaying medical care or treatment or testing due to possibly serious complications should they get COVID. And also due to the fact that they would possibly be discriminated against in a care rationing situation. So if you or someone you know is one of these individuals that have been putting off medical care because you are worried about getting COVID and you're worried about being discriminated against for life-saving treatment if you do get COVID, please come and take our survey. You can take our survey at nobodyisdisposable.org. And we will be using the stories, if you allow us to and give us permission to, for further advocacy work. Thank you so much.
Thank you. Great, you did put the survey information in the chat. That's wonderful. So, our next speaker, I think we're going to hear from Kimi Watkins-Tartt and Faith Battles. So Kimi Watkins-Tartt serves as director of the Alameda County Public Health Department. In this capacity, she provides overall direction and planning and leads the department's work in its pursuit of health equity in Alameda County and a culture of equity within the department. She has worked many years with the local public health community in the areas of public health, administration, policy development, and community health planning. She has also held many roles within the Alameda County Public Health, including Deputy Public Health Director and Director of the department's Community Health Services Division. She has a long-standing passion and commitment to health equity and social justice, is a founding member and current co-chair of the Bay Area Regional Health Inequities Initiative, and serves as vice chair of the Health Equity and Social Justice Committee on National Association of City and City Health Officials. I'm going to also read out Faith's Battles' profile, and then we'll go ahead and hear from them. So Faith joined the County of Alameda Social Services Agency Department and Health Aging Services in February of 2020 and is the Assistant Agency Director. Prior to that, she served in the county's Department of Children and Family Services for 20 years, with the last 10 years as Division Director. She's responsible for directing the recruitment and approval of resource parents, the operations and coordination of the county's assessment center and placement of children, youth, and non-minor dependents in safe and stable homes. Faith holds a bachelor's degree in law and society from the UC Santa Barbara and a master's degree in social work from San Francisco State. So we gave them a list of questions, gave each of you a list of questions, and I'm going to just read out the questions and then I'll let you go for it. So the questions we have asked are, how will open sites make sure the high-risk people, especially people of color, get vaccines? And what is the plan for IHSS consumers to get vaccinated? What is the plan for people who use non-IHSS home care to get vaccinated? What is the racial data for people who have been vaccinated in Alameda County so far? And what percentages of residents of nursing homes, assisted living facilities, and group homes have been vaccinated? And how do people without health insurance get vaccinated, particularly those over 65 who are eligible now? So let me go ahead and pass it to Kimmy and Faith.
So good evening. Thank you so much for inviting me here to be with you. I feel always honored when I am invited into a space to hear from community, hear concerns, so that we can ensure that services are provided to everyone in our county. And happy to be joined by my colleague, Faith. And so I'm going to go through some slides to answer hopefully some of the questions that you've asked. I'll skip over slides that I think are repeats of things that have already been said. So next slide, please. Next slide. So just some basic information on vaccine. Essentially, you know, the vaccine teaches our body how to fight certain diseases, and our body's immune system responds by creating antibodies. And these antibodies protect us from illness if we are exposed in the future. Some of the vaccines require multiple doses or boosters for strong immune response. As many of you have heard, the two vaccines that are available right now both require 2 doses. There's another vaccine by Johnson & Johnson that's on its way to emergency use authorization and is a 1-dose vaccine. We'll be seeing a range of these vaccines, I believe, over the course of the months. Next slide. This is just a slide to kind of show, and it's really hard to see, so I might skip over it, but it really shows a before and after picture of different illnesses that many of us are familiar with because we've heard about them, but many of us have never had to be exposed to any of these illnesses or diseases because we've had vaccine: smallpox, diphtheria, pertussis, tetanus, measles, rubella, polio. And so it's important to always remember that, and I know I'm speaking to the choir, vaccines do work, and we do have evidence and a long history of vaccine preventable diseases. Next slide. One of the things that is always hard to talk about and important to talk about is really acknowledging a history in this country of discriminatory practices, unethical and abusive medical practices. There is a lot of distrust of government and of healthcare systems, and that distrust has been well earned. Discrimination, unfortunately, still does persist in our systems. Systemic inequities and the conditions that we all live in really have led to some of us leading shorter, sicker lives than others. These conditions and those structures that create the conditions are unfair, and they are also preventable. General health status, access to quality healthcare, education, economics, housing stability, and other factors. We all know these things have profound impacts on how healthy a person is, how long a person will live. Next slide, please. We also know that, and we have been able to see very clearly in recent months, that the inequities that we are seeing are not inequities that just showed up yesterday. These inequities have been baked in to our structures, our systems, and a lot of it can be seen in where we see the disparities in our county. And Alameda County is not unique in this. You can look at very similar maps in other counties and see some of the same patterns. Those areas on the left side, this is an old map showing where redlining occurred. And if you look at the map on the right and you show where we have persistent neighborhood poverty by census tract going back to 1970, that those dark areas in the yellow map perfectly line up to those areas in red. And so although the discriminatory practices of redlining may have been outlawed legally, we know that there were informal ways of discriminating against people and maintaining residential segregation. But we also know that those patterns really solidified communities of disadvantage and communities of advantage. And we see the impacts of those early decisions and those early policies now. Next slide. When we first started our health equity work in the public health department, we always knew that the work had to cut across everything that we did. And we used the same thinking and the same values with COVID. At the beginning of the response, we stood up a COVID-19 health equity team, which is a group of staff who are responsible for key aspects of our COVID operation. The point and the purpose of this team, it's inwardly facing in the sense that we come together to look at our data, to advance strategies, to test out strategies, to evaluate the effectiveness of the work, to bring information back that we hear from the community to implement in order to ensure that our services are being done to address disproportionate impact. Our health equity team has focused on our testing work, our case and contact investigation work. It has also been used to shape health education and outreach, and as well as the supports that people need to isolate and quarantine. Now we're at the stage of vaccine, and our health equity team is also actively working with our vaccine team to ensure that vaccine is available to everyone. Next slide. Some of this was already covered by the previous speaker. I'll just reiterate a couple of pieces, and that is that the federal government, as we know, approves the science and some of the higher guidelines. The state puts together the framework and approves and develops the allocation. Here at the local level, we are responsible for distribution and data and reporting and monitoring. Next slide. This chart is a visual representation of the phases that the previous speaker spoke about. And right now we are in phase 1A, and we will soon be moving into phase 1B, tier 1 here in California. And as the previous speaker also mentioned, the state has been in communication with lots of health departments across the state and advocacy groups around the need to reconsider their decision around going to an age-based system. And so currently, and we have not received anything official, but as the previous speaker mentioned, at the state's community advisory meeting, they talked about inserting in between tier 1 and the age groups an additional group of individuals ages 16 to 64 who had underlying medical conditions. We are still waiting for final word on that. And from the previous speaker, there's still more work to be done to ensure that what sounds like what's a well-intended shift in policy doesn't have unintended consequences that still leave people out of vaccine. We will be joining you and helping to give voice to these concerns and really want to hear from you in terms of the ways in which the state's intention can be operationalized equitably on the ground. Next slide. When we began looking at how we would roll out vaccine in Alameda County, we really started with our values. And these values mirror the values of our health agency and our public health department. We want to be able to provide transparent and accurate information about what's going on so that you know what we're doing, you know how well we're doing or how well we're not doing, and that you all have enough information in order to make an informed decision about whether to get the vaccine or not. Vaccine is not a requirement. It is optional. It's a personal decision that we all will have to make when it's our turn. And it will be important for many of us who are ambivalent about it to have really good information so that we can decide for ourselves. We also want to maintain our commitment to lead with equity and with data, ensure safe and equitable distribution of the vaccine, as well as leveraging all the venues and partners to have as wide a distribution as possible. Next slide. Just to kind of summarize the slide very quickly, that our community, our local effort includes a community advisory group. We also have partnerships with our healthcare delivery system, our healthcare partners. And there's another component of this, which are all of the logistics that have gone into immunization delivery. Next slide. When we started our case and contact investigation work, we also extended contracts to community-based organizations to assist with outreach and health education. We currently are working with those same partners to help get the word out around vaccine. It's a challenging job, as previous speaker has mentioned. The framework around vaccine has changed several times, and we are all looking for another change to occur. And so it's really important to have accurate information out there and have it provided by people who people recognize, who people are in relationship with, and who people trust. Trusted messengers are a critical aspect of any kind of campaign such as this. And we really are wanting to launch a trusted messenger campaign in our county, where we have testimony from people who are getting the vaccine, who are able to talk about why they are getting the vaccine, or even talking about why they are not going to get the vaccine. It's important for us to be able to have dialogue about that so that we can all come to that informed decision. We also are participating in quite a few town hall meetings like this one, where we answer questions, we get feedback, and we incorporate that feedback into our operations. Next slide. So right now, our vaccine in Alameda County is distributed in two big buckets. One are points of distribution, or pods, and the second is through healthcare providers. The pods are largely run by the public health department and community-based partners. And the pods, we're calling them, or vaccine sites, some will be neighborhood-based, community-based, and smaller. And then there will be some that will be larger, like at the Coliseum or like at the fairgrounds. Within the healthcare community, there are lots of different ways that vaccine can be accessed through community health centers, hospitals, independent providers, and pharmacies. That group is expanding daily, and there will be even more changes to that as the state moves to implement its new structure for allocating vaccine throughout the state. Next slide. One of the ways that we are planning to ensure that the vaccine is accessible to those who have been disproportionately impacted by COVID is to locate the vaccine sites in communities that have been hard hit by COVID. We just started our first vaccine, community-based vaccine site today at Fremont High School in East Oakland. And this site, while open to anyone who is in the tier, is really for those individuals. And we really want the people who are from that community to take advantage of the resource that is there. We will be standing up more sites like this in the months to come. And these are also opportunities for us to partner with community partners to identify locations, to ensure that people can get to the site, to help people with registration and sign up, to help us greet people when they come, to make sure that the flow is comfortable and that when people come, they have a good experience. Next slide. Next, please. Oh, you know what? I needed to probably go back to that last slide. I'm sorry. Although we know that many individuals with disabilities live in the community, we also know that those in long-term care facilities are also at significant risk. We have 4,106 residents in SNFs or skilled nursing facilities. And the average age is about 76. one of the things that has occurred through the process is a focus, not just with the vaccine, but also with our COVID response of focusing on long-term care facilities. Those are the licensed facilities as well as the unlicensed facilities. And we are happy to say that through the efforts of the federal partnership as well as our department's efforts, we are hoping to be able to offer first doses to all of the long-term care facilities by February 10th. I want to speed up a little bit, so let me go to the next slide. Let's pass the slide. I can come back to this later. So I want to give more time for us to have more questions and answers. Let's pass this slide. So what I want to share with you a little bit is about who's getting vaccinated right now. This is not an entirely comprehensive picture. It only shows for a short period of time between January 9th and January 29th. And it is only reflective of the vaccines distributed at the sites that were run by the public health department. And remember, we've been in phase 1A, so these are healthcare workers. Most of the people who have been vaccinated at these sites were in the age of 51 to 64, followed by ages 41 to 50. So this largely represents our folks that are in the workforce currently. If you look over to the right, however, what you will see though is a very sharp disparity by race. And so right now, of the people vaccinated, 40% were Asian and 34% were white. In our African-American, amongst African-American healthcare workers, they make up 6.7% of those vaccinated. And for Latino population, 13.4%. And the Native Hawaiian Pacific Islander, 1.3%. Though this data is for a short period of time, it is a call to action. It's a red flag that we need to pay attention to and we need to act on very quickly to ensure that this pattern does not persist throughout the rollout of the vaccine. Next slide, please. Next slide. On our website, and I know that we have a lot of work to do on our website, and we are making lots of changes as we speak to make it more accessible to all. If you go onto the website, you are able to sign up as a resident or an employer or a healthcare provider and be notified when it is your turn. I'm going to stop now and pass on to the next speaker and look forward to all the questions.
There you go.
This is Jessica. I'm just going to interrupt for 1 second to offer our serious apologies that Zoom keeps making some really frustrating changes that affect accessibility, and we're understanding that the ASL interpreter was not showing up while we were screen sharing. I am very sorry. The rest of the time, I don't believe we will be screen sharing, and we will do our best to make sure that anyone who missed that information can get it after this. Sorry again. Thank you. And back to Ms. Battles.
Okay. Was somebody attempting to say something while you were talking, Jessica? Oh, Sarah said.
Oh, I just wanted to say that was just for the phone. On the screen on a computer, it was fine, but for the phone, that's where the problem is.
Okay. All right. Well, thank you very much. I'm Faith Battles. I am the Assistant Agency Director for Alameda County's Department of Adult and Aging Services. I've been in that role for just about a year, on February 10th, actually. And it's my good pleasure to have been invited to come here and follow my good colleague, Kimmy, and talk to you a little bit about the county's efforts around the vaccination. So to give a little context for those of you on the Zoom call, here in Alameda County, we have just about 23,000 individuals that are receiving IHSS services, in-home supportive services. And for those 23,000 individuals, we have about close to 24,000 IHSS providers. Those providers often provide care and support for more than one IHSS recipient. We know that a good number of our IHSS recipients are Asian descent. A good number speak English as a second language as well. We also know that a good number of our IHSS recipients have friends or family members that are their actual IHSS provider. A smaller amount of people have individuals that are providing IHSS services for them that are not related to them, that are completely unknown to them. In our work with the vaccine, what our responsibility is to provide information to the IHSS recipients or consumers or clients, as well as the IHSS providers about how they can best access the vaccine. It's important to note that Kimmy's team, healthcare services, and the public health department, they hold the responsibility of organizing and distributing and injecting vaccine to community members. For us, our supportive role to that effort and our consistent conversation with Kimmy and her team, public health department, is to provide information around how best to communicate to the 23,000 IHSS recipients and close to 24,000 IHSS providers. We're limited in what we can tell another entity because of confidentiality. So I can't very well talk to Kimmy and her team in detail about Jennifer Crandall or Reed Davenport. I can't give identifying information, for example. I can give general information. We are the go-between in between the public health department's information shared to the IHSS recipient and the provider. So far, what we've been able to do is provide the information that the public health department wants to get to the IHSS providers, because those are the first that were eligible to receive the vaccine. So the public health department would tell us, this is what we want to communicate to the IHSS providers. How can you help? Our responsibility is to get the information from public health department and send it out to all of our IHSS providers. We send emails out for everyone that has an email, right? Chloe, you might have received an email. Good. We send text messages out as well for those of us that don't have email or prefer to receive messages by text. Once that happens, then the consumer or the recipient or the client and the provider, they have the responsibility to go further to access the vaccine on their own. It's important for our IHSS recipients, clients, consumers, and the IHSS provider to keep our department aware of their accurate information. We have a good number of recipients or providers that we talk to maybe twice a year because of the nature of the services they receive, and either their email has changed or their phone number has changed or their address has changed, but we don't know that. And if we don't know that, then our efforts to get in touch with you won't be successful. For example, last year, we sent out stipends to IHSS recipients in Alameda County, the ARCH stipend, and it was $250. Some of you are nodding your head. You may have received one, or you're trying to figure out where yours is. I see Ms. Hannah nodding her head. We received probably 10% of those back because the mailing address was incorrect. So it's really, really important that you make sure we have your accurate address. Someone asked the question in the chat quickly about if those communications go to regional center clients. If any individual is receiving IHSS services from Alameda County, they will get that communication from my department specifically. We're sending out communications to IHSS recipients in Alameda County that are working with our IHSS program. and those IHSS providers as well. Someone had mentioned earlier about being concerned that their IHSS provider is not interested in getting the vaccine and that they're concerned about the possible exposure to that person and even their exposure. That is a good concern. We do our very best to make sure our IHSS recipients and providers understand what the vaccine is and the benefits of it. We work really hard to not try to convince individuals. It is a personal decision, and we want to respect people's reasoning for being hesitant around the vaccine. However, we do want people to know where to get accurate information and to not rely on information that may be untrustworthy or actually you should be skeptical around. We typically will refer our team members as well as our recipients and our consumers to the Public Health Department's website. That's where we get all of our information that we use to inform our employees, that we use to make sure our employees inform our clients. It is the most accurate information in our opinion. It is the most objective information in our opinion, and we encourage people to educate themselves around that. I saw a couple of questions I want to say really quickly before I forget. Someone asked about the ARCH stipend. I interjected that. If you're having an issue with your ARCH stipend and having not received it, the best person for you to talk to is the social worker that's assigned to your case. Let them know that you haven't received it. Some people have received it and their name is spelled incorrectly and they're not able to cash it. All that information we need to know so that we can have it reissued to you. We're happy to be able to do that. There will be no additional ARCH stipends at this point. These are all from December, but that just reaffirms the importance of making sure we have your very, very accurate information. The other thing I wanted to say is it's important in every community, specifically in this community with your very, very unique needs that often go overlooked, that you are consistent in talking to your social worker about what your individual needs are. I'm careful to caution you not to assume that they know, because I don't believe that they know all the time. And it's incumbent upon us to stay informed. So if my staff are not asking questions, make sure you inform them so that that can add to how they're able to support you and certainly add to our knowledge and our sensitivity around your very, very unique needs. So going forward, our intention is to stay closely connected with the Public Health Department and the Healthcare Services Agency so that we can continue to advise our recipients and our providers what is available to them and how they can access those services. We have weekly meetings around how to communicate to our recipients and our providers, and I am assuming that that will continue going forward. I'm happy to answer any questions that may come as a result.
Thank you so much. That was really great information, Faith and Kimmy. Really appreciate it. So now I think we're going to go to some questions. I have one question for you. What kind of accommodations will be provided to make sure disabled people have access to getting vaccinated?
So we've been looking at several different things to ensure access, starting from improving the technology so that people can actually, if they have access to computer and internet, that they can get an appointment, sign up, and that sort of thing. We've also been talking with community partners about helping people with appointments, as well as redirecting some of our staff to be able to take phone calls for people who would prefer to have a person talk to them by phone to help them get their appointment. So that it starts really there, getting the appointment. Also, we want to make sure that at the vaccine site that there is an opportunity for people to drive up and have vaccine brought to them. Everyone's not going to be able to, navigate getting out of their car, standing in a line and those sorts of things. And so what we're working on, and have done so at some of our sites already, is that we have what we call a strike team. And so a person they'll park their car, and then or whoever's driving them will park, and a team of people or a vaccinator will come over to them to vaccinate them in their car. Community-based organizations are really going to be critical partners for individuals who need assistance in getting to the vaccine sites. We are making every effort to locate vaccine sites near public transit so that folks who take public transportation can easily get to the site, but there will still be individuals who don't drive and will need to be brought to the place, to the site. And so having partnerships with those community-based organizations, we feel is going to really help people to navigate that. For people for whom English is not their first language, having people on site as greeters to be able to communicate with them, to be able to answer questions, explain what's happening. And in addition to that, we also want to provide health education to the individuals who come with people to get vaccinated. We know from the experience so far, a lot of people come with other people. Sometimes it's their attendant, sometimes it's a family member who brings them. And those individuals oftentimes also need information. Well, we all need information about the vaccine, and we want to use that as an opportunity to also share information with them. I'll pause if there are some more specific questions and things that we aren't thinking about that we should be thinking about. I really would love to hear that.
Great, thanks. So I just want to let everyone know, if you want to ask a question, now is the time to do that. And you can either raise your hand, you can press Alt+Y, or go to the Participants tab and raise your hand that way. And if you're calling from a phone, you can click 9 to raise your hand. And to mute or unmute yourself, you can press Alt+M if you're on the phone, and press 6. But only unmute yourself if you've been called on to ask a question, so we don't have so much background noise. And you can also put questions in the chat. So we have a lot of questions. We have a lot of hands raised here. So let's go to Sheila first. Sheila, can you go ahead and unmute yourself and ask your question?
First of all, it's *6 to unmute and *9 to raise hands if on the phone, on the dial-in phone, the old-fashioned phone. I'm glad you mentioned that some people don't drive. Right now I'm using paratransit. If I was to go to a pod, because Kaiser is far too far behind for me to use them, I would be using paratransit to get to the place. But if I had to stand in a long line and had no idea how long I would be there, I'm not sure how I would get out again. Most of the CBOs I know don't have vans. There might be some magic that happens, but I'm not aware of it. I'm very concerned that social workers are to be the front lines. Mine has a 330 caseload, and they switch our social workers without telling us. So I am very concerned at the faith that is being put into agencies that may not be able to carry the water, despite their will to do so. Also, last one, I want to know if the CAPTCHA has been solved on the notification site on the Alameda County vaccine site that everybody's being pointed at, but is not accessible to all comers.
I'd like to give a response to Sheila. Hi, Sheila. You and I have chatted over email briefly. In response to the The question about, or the comment about the caseloads, you're absolutely correct. The caseloads in Alameda County for social workers and IHSS recipients is high, in part because we have a huge number of IHSS recipients that actually live here in Alameda County. We consistently try to hire qualified social workers, which can take a little time to bring people into the agency, to have them screened, to have them examined, and all that other kind of stuff. That takes a little bit of time. We're intending on having a class in the summer, and we hire in bunches. So as many people as we can hire at one time, that's what we intend to do. So there's more to come. But it's challenging. The aging population specifically continues to grow in the state of California. It outpaces the employees that we have, and it will continue to grow. We're doing our best to try to keep up. The second thing is in terms of, oh shoot, Sheila, you said something and it just slipped my mind. You talked about the hiring. Oh, in terms of the social workers. Social workers staffing varies often for any number of reasons. Sometimes staff choose to take another position someplace else. You know, we're in the midst of COVID and staff are having their own challenges around managing their family with that. And we can't predict when staff are going to exit their employment. When that happens, we're obligated to move cases to another social worker. And a lot of times we don't have the opportunity to give great notice, and we apologize for that. We do our best to make that happen as quickly as possible. So you're always welcome to email me, Sheila, if you have questions or concerns or having issues related to the social work that you're receiving for your IHSS case, and I'll do my best. I know my team is very committed to making sure they do what they're hired to do. They have a passion for it. Lots of things get in the way, but we're working to do our best. Any feedback is certainly welcome.
Nicole, can I comment?
Sure.
On website information? So thank you, Sheila. And my colleague introduced us via email, and where you were able to share your concerns and share what was happening with the website. And so I don't want to misrepresent myself as a tech expert. I am not that. However, your concern was escalated very quickly, and the directors of ITD are attempting to address the issue as we speak. And so hopefully I will be able to get some information back on a timeline for addressing that, but they are working on it. And yeah, hopefully I'll be able to get some information back to you in terms of it being fixed and addressed.
Everything has been fixed except the CAPTCHA, but I don't recommend using Smartsheets again. I recommend Google Forms. They do have a HIPAA compliant form, as does SurveyMonkey.
Okay, thank you for that.
Okay, so we're gonna go to a next question. And just in the interest of time, if you just keep the questions one question, and we really want to focus on vaccine equity. So let's go to Victor. Go and ask your question.
Yep. Hi. Thank you very much for this wonderful presentation and your attention to detail and your clarity in presenting. In the interest of brevity, I heard recently a segment on the radio in which Kaiser, in which they used an example of a Kaiser insured health care provider was using, this was in the city, I imagine it's the same in Oakland, using free or easier to get appointments through the city that then used up the city's supply of injections, and then it because the turnaround time was, well, anyway. So I just wondered about the, this is related to equity and distribution. What's to keep those, I'll just put it this way simply, keep those balances in line, or those alleys in the right lanes?
Right. Yeah. Thank you, Victor, for that question. That's a very good question. So one of the things that I think it's important for all of us to remember is that although vaccine is available, it is still in short supply. We still don't have enough vaccine for everyone who wants vaccine. And so the supply part of this is still challenging. Our health system partners, Kaiser and Sutter and all of those health systems, are also, working to really ensure that they're getting to all of their members. And because there isn't enough vaccine in our system as a whole, even if as a Kaiser member should be entitled to vaccine at Kaiser, they may not have any more vaccine. And so then I might find myself going to another site, a county site or something like that. And so I know that they are working really hard. We're all working really hard to try to prioritize and be very careful about how we're prioritizing the limited resource that we all collectively have. And we are hoping that the supply increases shortly. When there's enough supply for all of us, we won't be having these conversations like this. But I'm hoping that that's not happening too much in Alameda County. But I do know that, there have been problems accessing appointments with some of the providers. As with us too, we run out of appointments as well. We've had that with our Castro Valley site, our St. Rose site. And so, it's been a partnership across our system of really trying to make sure that, there's a place for someone to go. Preferably they go to their healthcare provider. But I would imagine, yes, that what you're describing probably has happened in Alameda County as well. I don't know how much it has happened though.
Thanks. So we're gonna go to Brandy next, and then after Brandy, we're gonna go to Helen. So let's go to Brandy for your question.
Thank you. I just had a question regarding Alameda County's community sites, including the community sites in the hardest hit areas. Will these sites be giving vaccines to people with disabilities and people with the underlying condition, or with the conditions that are being now prioritized through the state?
So we are still obligated to follow the state's framework. And so what I described to you and what the speaker, who's the person who spoke prior to me, what we both talked about was something that was discussed at the state's community advisory body. I haven't seen yet the new guidance from the state and the actual new framework. So we are not yet authorized to actually move to include people with underlying health conditions at this time. But we have received that signal that this is their intention. If they move to include individuals with underlying health conditions, then yes, we would be able to vaccinate people who qualify. Again, we are still bound by the state's phases. And so, yeah, I hope that answers your question. So they haven't really made that official yet.
I guess my question is, so you're bound by their phases. I get that. Are you bound by if they say those individuals need to get the vaccine from their healthcare provider?
If they include that in the guidance, then yes, we would be. If they say that local communities are required to get verification from their provider or go to their health provider, then yes, we would be bound by that. It depends on the language and what they say, how they language this.
Okay, that makes sense. Thank you.
Great. Next question. Let's go to Helen.
Are you talking me, Helen Walsh, or a different Helen?
I think it's you, Helen Walsh.
Okay. I want to thank you for the information. My question though is, I'm going through the website information on Alameda County. I also use a screen reader, but I also use other adaptive equipment. So with that being said, I'm not noticing any area on the site where an individual, even now, who's can get a vaccine, like say you have an older person with a mobility issue that doesn't drive. I don't see any information that is talking about any kind of accessibility or who to contact. And I'm also noticing that a lot of the setup doesn't apply to people who aren't in the system. I'm not up for a vaccine, but when I am up for a vaccine, I'm an individual with a disability that does not drive and is not in a system. Right. My current health provider, who doesn't have access to the vaccine, even for my folks that are elderly. I don't want to go too on and on here, but I'm wondering if some considerations can be made here for information being more readily available or somebody to contact, because I know right now individuals with mobility issues, they're senior citizens, are having quite a time. I'm helping my folks and I'm one who is noticing this. So I just want to bring that to your attention. And of course, the website doesn't have any information, usually an accessibility page or something that gives some information. We will have accessibility information pertaining to what the site provides us. If there was something like that, I think it would be helpful for individuals. And even now, can't say it even stronger, even now it would help. And I'm hoping you'll take that into consideration as a solution that the disability community can provide you to make this a smoother rollout for everybody and provide that equitable means. Thank you.
Thank you for that.
Okay, let's go to Greg next. Greg, do you want to ask your question?
Hi, thank you so much. I really appreciate you taking the time here. It's very helpful to ease people's worries. My question is, if an Alameda County resident who suffers from a rare disease that causes a profound immune deficiency, and so assuming that that person falls within the revised guidelines, hopefully, their healthcare providers are exclusively outside of Alameda County. They're in San Mateo County and Santa Clara County. If they don't have a healthcare provider in Alameda County, will there be a way, because I understand that those two counties are limiting vaccines to residents of their counties exclusively. That's what we heard from one of the providers in San Mateo County, that they could only residents of that county could receive it. If that's the case, what will somebody who would otherwise be eligible to receive a vaccine in Alameda County, what would their access to the vaccine be?
Okay, I'm not sure I'm entirely following what you're asking. Let me make sure I understand. So if a person who's a resident of Alameda County has a medical provider from another county.
Correct. And does not have a medical provider in Alameda County, will they still be able to get a vaccine in Alameda County?
So again, it's going to depend on how the state writes the guidance, but I cannot imagine that the state would write the guidance stating that you must get certification from an Alameda County provider, because we have medical providers where we have them, you know what I mean? Okay. And so we're interested as a county, we want to make sure that our residents, no matter where they're getting their healthcare, our residents can access those services. Now, what I also think I heard you say is that some other counties are attempting to restrict access to the vaccine to only their residents.
That's correct.
But if you are a patient of a medical provider that is authorized to distribute vaccine, I don't think they can say they can't give you the vaccine. I've never heard of that. I don't think that that's gonna be.
We recently, and I won't identify him, but we recently ran into personal knowledge of that happening.
Okay, well, I need to follow up on that, because that, yeah, that's not, it's not really sustainable. I mean, You know, and especially in the Bay Area, we're a region.
Yeah.
And we're all moving around, you know, we live in one place, we work in another place, our family's in another place, you know, and
Yeah.
so
So if for instance we don't have a relationship with Kaiser or Pam for somebody with a location here, will there be sites that we could we could access as an Alameda County resident?
So we've been assured that we will, even though the state is changing their structure and they're going to be centralizing allocation throughout the state. So we will not be doing allocation anymore. No county health department will, but we've been assured that we will still get some amount of vaccine. The public health department will. We don't know how much we will receive. We will continue to do community sites with whatever amount of vaccine we have. And so we are committed to that. We just don't know what our volume is going to be. And we will serve those individuals who meet the criteria and try to ensure that the experience is positive and that we're able to reach people who most need the vaccine in our community.
If I can ask one just related follow-up, is it possible that the county can require that providers in Alameda County make vaccines available to patients who are not their patients, so that so for instance anyone can go to Kaiser?
I don't know necessarily that we would make that requirement. Let me check into that one, because
that seems to be the most fair access. If Kaiser has vaccines that were allocated to Alameda County, that Alameda County residents should have access to those vaccines, whether they're a Kaiser patient or not.
So for the multi-county entities or MCEs, they have a bolus of vaccine and they distribute in their system. So, you know, they get their own allocation. And so it didn't come through the public health department necessarily. And I'm not privy to how they allocate it to all of their sites, like Kaiser, for instance, or Sutter. I'm not sure how they did their allocation in terms of how much volume they gave to Kaiser Oakland versus San Francisco versus San Leandro, you know, and so on and so forth. But not their doses regionally as a group, as a whole package.
Okay.
Okay.
Thank you.
Thanks. Let's go to, I think we're going to go to Ira, then Margaret, and then Jean and Hannah. So let's go to Ira next.
Okay, so I'm still not clear on what we're supposed to do to get on the list or how to get the vaccine. Do we go to that website? And if so, I didn't get a chance to really copy it down.
So on our website, there's a place where you can sign up to be notified when it's your turn.
Okay.
And it says, you know, for residents, and you go on to that and fill out your name and information, and then we will notify you when it is your turn and invite you to come to a site and invite you to schedule an appointment.
Okay, could you repeat the website?
I think someone just put it in the chat, but it's if you go to acphd.org.
Wait a minute, AC.
PhD.
Yeah, and we'll make sure that everyone gets that information too.
Okay.
Oh, it's in the chat.
Mm-hmm.
Oh, I see it.
And Kimmy, can I just jump in? 211 is live today with special assistance, and they'll be they have dedicated staff to help people that will are having trouble with the online. Their staff are taking calls Monday through Friday, 8 a.m. to 5 p.m. to help people sign up.
Excellent, excellent. Thank you. Is that Tram?
Yes, it is.
Thank you, Tram.
All right, let's go to Margaret next.
Okay, It sounds like I'm probably barking up the wrong tree because it sounds like it's Newsom that's making these decisions. But I just was going to share how it feels to me, to someone who I have 700 hours of care a month, 6 different people that come in to provide those hours. And I already have to do all the management and all the other stuff. And it feels like authorities are punishing those of us who are privileged enough to be able to live in the community by not giving us access. You know, I am in a nursing facility waiver, as in a waiver to keep me out of a nursing home. And it just feels like that is being punished. And I understand, I know that it's not a communal setting, and I know all these other things, you know, but that's how it feels to me as a person who's having to deal with this. And I tried to go get my vaccine today, and there were dozens of appointments available for the site that I was going to. And, you know, because I'm born in '86, I can't get it, which just is absolutely irrational when I'm literally on a breathing machine. And, you know, supposedly they won't take it away from me if I get stuck in a thing. But have you ever tried to get people to actually obey the law when you're in a hospital? Especially when you're in a hospital, like this body? Like, no, that doesn't work. So, you know, that's all I wanted to share. But it sounds like I'm barking up the wrong tree because you guys aren't even the ones that are going to be deciding on all this stuff. So, but thanks for letting me share.
Can I, Nicole, can I just say that, you know, because the state is considering and they put it out there that they are attempting to adjust and rethink the framework, it tells me that the advocacy works. It absolutely works. And so keep at it. We need to keep getting the information there. We need to keep saying what we need to say until we collectively get it right. It works. It's not because, you know, it's because people spoke up. That's why this is being changed. So.
Great, absolutely. Yeah, we got to keep the pressure on. Let's go to Hannah next.
Hi, thank you. Thank you all for being here. It's really great to see such a good turnout and everything. My question is really short. I just wanted to know where I can refer people I know who work as home care workers, but privately. They're not in IHSS. They don't work through an agency. How can they verify that they are caregivers?
Right. That one is a very challenging one. You know, I don't want to, let me get that information back to you because I know that, let me get that information back to you.
Thank you. I appreciate that. I'll put my email in the chat.
Okay, thank you.
I've heard that if you're a private employer that you can give a letter to your worker and a pay stub and that they could get vaccinated, but I don't know if that's actually true or not.
Well, so any sort of documentation that you have from your employer would be acceptable in terms of pay stub and that sort of thing. I was thinking you were talking about something that's more informal and you don't have those things.
Yeah.
Right. So let me get back to you to see how that's, when there's documentation and paychecks and stubs, that's what we've been looking at. When there's a company that you work for, if there's a badge, you know, that sort of thing, that's what we're looking at.
Right.
Let me get back to you about what I think you're asking about the informal caregiving.
Thank you.
Okay, great. So let's go to Maya next.
Hi, can you see me?
Yes, you can.
And hear me? Hi, I'm Maya Sketchung, pronouns they, them in Oakland. I'm actually sitting at a table with 3 of the 4 of my family members, and I had a couple of questions. We live in a 3-generational household where the oldest person is 86 and actually the only person that isn't considered disabled, but she's the only person that currently is prioritized for the vaccine. And my 16-year-old has type 1 diabetes. My husband has low platelets and lupus, and I have a congenital heart condition, and I'm also a wheelchair user, and have also been delaying necessary surgery because of COVID. I was told about a year ago that I needed foot surgery, but I've been holding off because I was told that I would need to go into a skilled nursing facility for 3 months, and I am not doing that during COVID if I can help it. So I'm wondering, like myself, I'm 55 years old, so age-wise, I'm definitely not a priority, but both with my congenital heart condition and my need for surgery, I'm likely to be someone who would have really highly negative outcomes with COVID. And I also have mobility issues. And so I'm partly wondering, just in the ecosystems of families, if that is considered, if if our daughter was supposed to go back to school, for example, she would be very high risk to be at school. And I list right now, but I have, can't drive and can't walk more than like a half a block unless I can get surgery. And the question, I also did want to double up and reiterate that the question about accessible, affordable, wheelchair accessible transportation to get the vaccine is something a lot of people have been bringing up in my Facebook page and private messaging me and trying to figure out how they can get their family members in wheelchairs who don't have access to paratransit, who don't have wheelchair accessible vehicles. A lot of folks are kind of stuck in this one, especially if we think we have to wait. So got a few questions there.
Oh, so I know that some of these issues have been raised with the state. And I believe that some of them, if they move forward with changing the framework and changing how they're handling the phases, some of what you shared and presented would be taken into consideration. And so more individuals in your household then would likely be eligible for the vaccine. I don't know the exact medical conditions they're going to be considering, or they can consider all of them, because those are the conversations that they've been having. That, are we talking all medical conditions? Is there a threshold? What kinds? That kind of thing. And I believe that's also where they got into the needing the medical verification, because if I'm working at a vaccine site, I'm the public health director, but I'm not a physician. And so I am in no position to determine whether your health qualifies, you for a vaccine. A medical professional needs to be determining that. And so we'll have to see, what comes out of that. But I think because they're still thinking on it, advocacy works. Advocacy works. I think it's important to get these messages up to the state so that they're taking these things into consideration.
Definitely. And I just want to say this is a great forum, and it's so great to have you really, really listening and interested and engaged with us. So thank you so much.
Thank you.
So let's go to Karina next.
Hi, thanks for giving me a chance to ask a question. I really wanted to raise up a item that was posted in the chat from the executive director of the Regional Center for the East Bay. She's expressed interest in working collaboratively with the county to identify individuals with intellectual and developmental disorders to coordinate them when they're eligible. And that raises a really big red flag to me that that communication lines aren't already existing between the county and the regional center. So I guess the question is, will you please contact her to coordinate that effort?
Yes. And so we do have a developmental disabilities coordinator, Ben Chen. He's actually on the call right now. And Regional Center is a longtime partner of the Public Health Department. And so we will absolutely reach out to our colleague.
Thank you.
So I have a question. Can you, what recent data do you have to inform vaccine distribution in the disability community?
I need to take a look, but I don't know that we have that data right now. We just put up our dashboard, and so the data that we have is still it's in its early stages, and it's not from across the county in terms of all of the different providers. And we're going to also be moving to a different mechanism to pull the data. So let me take a look at that to see if that is information that is being collected, because that also drives what information we have access to that we can disaggregate and show where disparities are. And so if it's not something that's required be filled out when vaccines are being administered, we won't have that information. And so we need to put that up front now and make sure that it's in there as a required field in whatever forms people are filling out. Because there are a lot of fields in the CARES data, the state database, but all of them are not required. And so we need to let me go check on that. I need to see about that.
Okay, thanks. And what working relationships do you have with the disability community?
So I mentioned earlier that our department has a coordinator that coordinates our Developmental Disabilities Council, and the council has been in place for several years and is really a powerful advocacy force to ensure that people with disabilities have access to resources and services. We also have a very large program, our California Children's Services Program. And we work with not only families with children with disabilities, but a range of providers, not just in Alameda County, but across California and in other states as well, coordinating services for children with severe disabilities. And so we do have a lot of relationships, partnerships, a lot of work that we do to serve people with disabilities. And so.
Is there anyone else would like? We have some more time if there are other questions out there. Please raise your hand or put it in chat. Oh, we have a question from Robin Earth. Robin, go ahead with your question.
Hi, I have a question. I have Kaiser and I'm under 65 and not eligible based on age, but certainly I'm at risk because I have a respiratory disability and use supplemental oxygen and have had respiratory failure before. My concern for myself is I don't have a car and I haven't taken a bus since March 14th because it doesn't feel safe to me. So to take buses crammed with other people trying to get vaccines seems counterintuitive, productive, all of the counters, even though I really want to get the vaccine. So I'm concerned about that. I also want to put out that I'm wondering if I have Kaiser, once there's a point that I'm able to get a vaccine, do I have to go through Kaiser if I can get it more quickly and closer in Berkeley? Like I have Kaiser, but I was able to get my flu shot by walking 3 blocks to the CVS at Target from my house. So, and they had some kind of contract with Kaiser, they could do that. But I haven't been able to learn because Kaiser doesn't have a way for me to contact them Right now, they're so overwhelmed on what the access will be for people who have Kaiser or other health centers to be able to go through the county or the city or the pharmacies that are around them. Do you know that answer? Thank you.
So I'm in no position to answer for Kaiser and their policies and procedures, but what I can say is that we are in constant communication with our health system partners. And so the concerns that are raised in the community, we do bring those concerns forward and share them with them. COVID is requiring that we rethink the ways in which people access services. And so a lot of the things in terms of just the whole transportation piece has been turned on its head. Because although we have a public transit system, a lot of people are not comfortable taking public transit just yet. And so I don't know exactly what Kaiser's resources are for its members, but I think maybe asking them, have they made have they put anything else in place to help their members who are not able to take public transit anymore or not comfortable taking public transit anymore, get to them. We are encouraging people to use their healthcare provider to get their vaccine. However, if it's between you not getting the vaccine when you're eligible and going to Kaiser, I want you to get the vaccine where you can get it, and so but again, all of us collectively, we really need to try to be creative about how we help people to get access to the systems that they should have access to. And it is going to require something a little different than what we were doing before. It's not business as usual. It absolutely is not.
I would just piggyback on that. So my mom is a Kaiser patient, and I actually spoke to her doctor directly, and her doctor basically said that they weren't sure how soon they were going to be able to vaccinate her, and so to go ahead and sign up with the county's site to get the vaccine, and she was able to get the vaccine through the county as opposed to going through her Kaiser doctor, because it was the Kaiser doctor said it could be another month or more for her to get her vaccine. So we have a question from Jean, I believe.
Hi, thank you. That kind of brings up a couple, Nicole, you kind of hit on that point I was talking about. If you can't, I don't know, when you go onto the website to sign up, I don't see, it tells you now what they're doing, and they're going to update weekly on what the state guidelines are going to be. So I assume they're updating every Thursday because they updated last Thursday. So I assume since they changed the phase 1B, and now they're starting February 8th. You can't sign up until February 8th if you're in that phase. So how are people able to get onto a list now if we're not even talking about the phase?
Or are you talking about our site?
I guess I went to the one that was put in the link, the COVID-19 acgov.org vaccines. And I went to that, and it says, where you are, when is it my turn, and that sort of stuff. It takes you to these different phases. They tell you what phases they're in now and what phase will be starting on February 8th. So I assume we're asking the state to change their guidelines. And so I'm assuming maybe since they may be changing it weekly, next Thursday, we might hear that the disabilities, that portion might be implemented at that point.
That I don't know. I'm not sure about when the state is going to make their final decision.
There's no time frame at all.
I have not heard about a time frame.
Okay.
I just have the notes, and the information from the community advisory meeting that a lot of us also were on that call and heard them share what their thinking was, but I haven't heard them give any date.
Okay.
This is Lauren. Oh, can I interject quickly? Sorry, from that call, this is Lauren from Public Health. They did mention that the next stage is to go to their drafting guidelines work group on Friday. So that will be that's the next, but then the drafting guidelines work group finalizes their recommendations. So That's just the next step.
So tomorrow's Friday. Is that, you mean Friday tomorrow or Friday a week from Friday?
Correct. Friday tomorrow is when the final sort of recommendations go, but then they still have to be approved by the, the ultimate state powers that be. So just the next stage in their approval is tomorrow. So hopefully we'll get an update at some point after tomorrow, but I don't believe it then becomes final.
Okay, so then is there 2 places that you can sign up to get on the list, even though you haven't been prioritized yet? So my sister has disabilities, and she has Medi-Cal, she could go through her doctor, or can she also get on a state list now? Or do we have to wait till this whole thing is worked out?
So you could go to our website to sign up to be notified when it's your turn. And so the way we've been handling it is that we send an invite. If you sign up on our list, then you fill out information that gives us some information about when your turn might be, essentially, some certain characteristics. And then we call that list, and then we send invitation to you and say, it's your turn, essentially. You can sign up, follow, go to this link. Now, we are going to be changing to a new platform. The state is now requiring all local health departments use the My Turn platform. And so what I'm describing to you may operate somewhat differently, but it should be mostly the same, because the My Turn application also has that, where you will be notified when it's your turn and be provided information where here's where you go to get an appointment, kind of thing.
Okay, so that is just to sign up to say, okay, now it's your turn to go sign up. It's not like, okay, it's your turn, come on down here and get your shot, right? Okay,
Right.
all right, I just want to make sure I understood. Okay.
Yeah, I know, it's sign up to sign up.
Again, okay.
I know.
So
thank you.
Thank you so much for being able to answer all of these questions. There were some really great questions out there, and we just really appreciate your time tonight. So we're going to now go, and we're sorry we weren't able to get to everybody's question, but if you put them in the chat, we'll pass them on and get back to you. And so now,
can I throw a quick one? So if I've already signed up on My Turn, if I've already signed up on My Turn, am I good? And I've signed up on Alameda County too, will they all figure it out or what?
Here's what I can say. I can say that if you signed up with Alameda County, we'll have your name. I can't say about, what these 2 systems are going to be doing, but if you signed up in both places, we'll get you. We should have your name then.
all right, so let's go to Jessica to talk about what actions we can take.
All right, thank you so much, Nikki, and thank you to Kimi Watkins-Tartt and Faith Battles for the presentations and the helpful answers to our many, many questions. So I think a lot of people have been talking about, okay, if a lot of these decisions are made at the state level, how do we get the governor to listen? And as Brandy was talking about, we know that it's pressure, particularly from disability communities that have gotten, some word that there's going to be a different plan from the state. So we need to keep up the pressure until we know exactly what that plan is and that it's a good plan. And so we have a toolkit for taking action. And the specific thing to do is call the governor. Call the governor every day, twice a day, get your friends to call, post on social media to let them know that you have a disability or what age you are, that you're at high risk for COVID, and that you need to get vaccinated and that they need to change it to make that work. And I think someone's going to be putting the toolkit link in the chat momentarily. Let me see if I can get that there for you. Okay, so there's the toolkit link. And then it is so great to have so many folks here tonight. A lot of new people. We need to continue to organize together, to collaborate with the county, to push the state, to figure out what our community needs. And so we want to invite you to join Senior and Disability Action. We are all seniors and people with disabilities and allies working together to create a better community for all of us. So you can click the link and sign up online. You can also just put your phone number in the chat if you want, and one of us can contact you and let you know more about what it means to get involved. We also have our general meeting, our monthly meeting next week, next Thursday from 10 to 12. And everyone is welcome at that. We'll be talking about this as well as other issues going on facing seniors and people with disabilities throughout the Bay Area. Share your story on social media, right? So many people here tonight have really powerful stories that most people just don't know, and we need to get that out there. So you can use the hashtags #HighRiskCA, like I have above my head here, #VaccineEquity, and #NoBodyIsDisposable. Lastly, if you are delaying care because you're at risk for COVID, the No Body is Disposable Coalition wonderfully put out a survey. So please share your story in that survey and share the survey with your network so that we can tell those stories of how people are affected by not getting the vaccine. So I think those are some of the key ways to take action, but let's be in touch with each other so that we can figure out more. We will send a follow-up email to everybody who signed up for tonight with information, questions and answers from tonight and information about how to find out more. And I'll pass it back to Nikki.
I just want to say one more last really deep gratitude and thank you to Kimi Watkins-Tartt and Faith Battles, Gwen Butler and Brandy Senziak for your roles this evening. We had a lot of questions and you really were attentive in trying to answer them. Thank you so much. And I want to thank all the organizations who sponsored us tonight and your community members here to show your concern. And also thank to our ASL interpreters. And we just encourage everybody to take action. And thank you so much for being here. Good night.